Morning, ladies and gentlemen. Today we're going to talk about the flu for health section. Influenza is a viral infection that attacks your respiratory system, your nose, throat, and lungs. However, the influenza, commonly called the flu, is not the same as the stomach flu. Which is a kind of virus that causes diarrhea and vomiting. For most people, influenza or flu resolves it by its own, but sometimes it can be deadly. People at high risk of developing flu complications are usually young children under 5, especially those under 2 years old, adults that are older than 65, residents in nursing homes, other long-term care facilities, pregnant women, people with weakened immune system, people who have chronic illness such as asthma, heart disease, kidney disease, and diabetes, obese people with a body mass index of 40 or higher. And remember, our best defense against influenza is through the annual flu shot. Now, initially, the flu may seem like a common cold with a runny nose and sneezing and sore throat and other symptoms, but colds usually develop slowly, whereas the flu tends to come on quite suddenly. Although a cold can be bothering, you usually feel much worse if you have a flu. Some symptoms are fever over 38 Celsius degrees, aching back, arms, and leg muscles, chills and sweats, headache, dry persistent cough, fatigue and weakness, nasal congestion, and sore throat. Now, when should we see a doctor? Most people who get flu can actually treat themselves at home and often don't even need to see a doctor. But if you have flu symptoms and are at risk of complications, well, then you should see the doctor right away. Taking antiviral drugs within the first 48 hours after your first noticed symptoms may reduce the length of your illness and help prevent more serious problems. So you have to be very ready. What are the main causes of the flu? Well, flu viruses travel through the air in droplets when someone with infection coughs or sneezes or talks. You can inhale the droplets directly, or you can pick up the germs by an object such as a telephone or a computer keyboard, and then transfer them to your eyes, nose, and mouth. Now, people carrying the virus are likely contagious from the day before the symptoms first appear for about 5 days. Although in rare cases people are contagious for even 10 days. Now, children and people with weakened immune system may be contagious for even a longer time. Now, influenza viruses are constantly changing though, with new strains appearing regularly. So if you have had influenza in the past, your body already made antibodies to fight that particular strain of the virus. But if future influenza viruses are similar to those you have encountered before, either by having the disease or by vaccination, now those antibodies may prevent infection or actually lessen the severity of the symptoms. But antibodies against the flu viruses might also be specific for other type of influenza virus. Now, in that case, they are not effective. It is interesting to know which are the factors increasing the risk of developing influenza. Like age is an important one. Like seasonal influenza tends to target young children and the elderly. Living conditions, people who live in areas with high population density or nursing homes or military barracks are more likely to develop influenza. Conditions of weakened immune system like cancer treatments or anti-rejection drugs or corticosteroids and such other drugs. This can make it easier for you to catch influenza and may also increase the risk of developing complications. So always be careful when taking this kind of drugs. Chronic illness or chronic conditions such as asthma, diabetes, and heart problems may actually increase the risk of influenza complications. Now, pregnancy, and especially the second and third trimesters are very important, very crucial. And obesity, people with body mass index of 40 or over 40 have an increased risk of complications. How do we treat the flu? Well, usually you'll need nothing more than a bed rest and plenty of fluids to treat the flu. But in some cases, your doctor may prescribe antiviral medications such as oseltamivir, like Tamiflu, or zanamivir, like Relenza. Now, if taken soon after you notice the symptoms, these drugs may shorten your illness. If not, they can actually be also ineffective. Antiviral medication side effects may include nausea and vomiting. However, the side effects may be lessened if the drug is taken with the food. An additional concern is that some strains of influenza have become resistant to oseltamivir, amantadine, and rimantadine, which are older antiviral drugs. So it is always recommended to use the newer ones. What kind of lifestyle should we adopt, and are there any home remedies for the flu? Well, drink plenty of liquids first of all. Choose water, juice, and warm soups to prevent dehydration. Now, rest, get plenty of rest. Get the right amount of sleep to help your immune system to fight the infection. And then consider pain relievers, such as an over-the-counter pain reliever, such as acetaminophen, like Tylenol or others, or ibuprofen, such as Advil, Motrin IB, or others, in order to combat, to fight against the achiness associated with influenza. How to prevent it? Well, general recommendations are to get the flu shot over the age of 6 months. Each year's seasonal flu vaccine contains protection from 3 to 4 influenza viruses that are expected to be the most common during that season. Now, the vaccine is typically available as an injection and sometimes as a nasal spray too. It is possible to control the spreading of the infection, but consider that the vaccine is not 100% effective. Here are some measures you can take. Always wash your hands. This is one of the best ways to prevent many common infections. In alternative, use alcohol-based hand sanitizer if soap and water aren't readily available. Contain your coughs and sneezes. Cover your mouth and nose when you sneeze or cough in order to avoid contaminating your hands. Cough or sneeze into a tissue onto the inner crook of your elbow, right? Like this. Avoid crowds, of course. Remember that flu spreads easily wherever people congregate, such as childcare centers, schools, office buildings, auditoriums, and public transportation. So this way you reduce your chances of infection. If you're sick, stay home for at least 24 hours after your fever subsides so that you lessen your chance of infecting other people. I hope this video is helpful for some of you. If you have any questions, please do not hesitate to email me at raf.pilla@gmail.com. Again, raf.pilla@gmail.com. Thank you for watching.